Talking therapy is a great way to help you in your recovery from anxiety, but finding the right type of therapy and therapist can feel confusing. There are so many different types of therapists with different qualifications. The good news is that there are many types of talking therapy that have been proven to be effective for anxiety. You may have heard of names like cognitive behavioural therapy, interpersonal therapy, psychodynamic psychotherapy, acceptance and commitment therapy, or exposure therapy. These are just some of the therapeutic models that can be used to treat anxiety. Each type of talking therapy takes a different approach to learning new skills and providing a space for you to develop ways of coping with anxiety in your daily life. Some types of therapy are more practical and skill-based, whilst others are about reflection and analysis. The most common form of therapy for anxiety is cognitive behavioural therapy, which focuses on the here and now to identify patterns that maintain our anxiety. These might include the physical sensations of anxiety, the thoughts that run through our mind when we're anxious, emotions that come up in response to those thoughts, and our behavioural responses. Cognitive behavioural therapy uses a practical approach to interrupt the vicious cycle of thoughts, feelings, and behaviour. Here are some examples of other therapies that approach anxiety from different perspectives. Psychodynamic therapy and attachment therapy looks at how your early life experience impacts you now and contribute to anxiety. Schema therapy and interpersonal therapy help to identify patterns in your relationship that could be maintaining anxiety. Trauma-focused therapy and EMDR address past traumas that could be linked to your anxiety. Acceptance and commitment therapy help you to learn other ways of managing negative thinking. So you might be asking, which therapy is right for me? Your relationship with a therapist is one of the most important factors in having a successful therapy. So you should find someone who makes you feel safe and understood, regardless of what type of therapy they do. Sometimes you might feel stuck during therapy as though your problems aren't shifting. Change can take time, and it's always difficult to challenge our fears. We're not always ready to change, even when we really want to feel different. It's okay to talk to your therapist about concerns or doubts, or about anything you feel isn't working for you. Having difficult conversations is a normal part of therapy. Also, don't be afraid to try different therapists or types of therapy until you find one that suits you. Please see the information about different types of therapy in the links below. So far, we've only talked about individual therapy. However, some people find that group therapy, couples, or family therapy can be useful, especially if their anxiety affects the way they relate to people around them. If you are interested in getting help for anxiety or any mental health condition, please speak to your family doctor or talking therapist. They may be a qualified psychologist, psychotherapist, or counsellor. Check that they have the right qualifications by making sure that they are registered with a recognised professional organisation in your region.